I'm Julianne Mobilian, Managing Editor of Drugstore News, and welcome back to our ongoing series where we interview important thought leaders in retail pharmacy. So our guest today is Dr. Jonay Khaldun, Vice President and Chief Health Equity Officer at CVS Health. Dr. Khaldun, thank you so much for joining us.
Thank you for having me.
Yeah, so let's get into it. Why did CVS feel the time was right to launch the Community Equity Alliance?
Yeah, that's a great and important question. So there is no question that health inequities and health disparities are a crisis in this country. We know that 30% of Black Americans are more likely to die from heart disease than non-Hispanic whites. We know only a third of adults actually receive the mental health treatment that they need. So there's no question that we really are seeing stark disparities. And it's really, really important that we as a healthcare innovation company really think about what we can do to address those disparities and inequities. And so we launched this Community Equity Alliance to do just that. We are really focused on partnering with academic and healthcare organizations to make sure we're understanding the experiences and elevating the voices of those on the ground in historically marginalized communities, and making sure we are elevating their voices in a way that really advances disparity reduction, particularly around mental health and heart health.
Oh, absolutely. And I saw too, what do you hope to accomplish by partnering? I believe it was Meharry Medical College, Sinai Chicago, and Wayne State University. They're all joining the initiative. So what are some of the things you're kind of hoping to accomplish there?
Yes, really excited about our initial 3 partners for this alliance. And what we are anticipating is that we will help to advance the community health worker workforce. So our partners are training community health workers who are evidence-based, really important partners when it comes to healthcare teams. But we also know a lot of people don't have access to these community health workers. So we're training community health workers. We're embedding them actually into care teams with these healthcare partners. And importantly, back to my initial point, we're actually speaking with our partners, with members of these communities, and really understanding, why do these disparities even exist? What should we be doing as healthcare organizations in these communities? And what are the solutions that we can work on together to be able to decrease health disparities? So expanding access to the healthcare worker, community health worker workforce, and really focusing particularly on heart health and mental health disparities.
How will the Alliance expand the community health worker workforce? And kind of to follow up with that, why is that crucial to the communities you're targeting? You kind of mentioned it earlier, but I was wondering if you could maybe touch on that a little bit further.
Absolutely. So there's a couple of ways. One, we are partnering to actually train community health workers. So community health workers are members of communities who don't have any specific health degrees. So they're not nurses, they're not doctors, they're not social workers, but with very, very tailored training, we can help these, again, people from communities often living in historically marginalized communities, train them to be able to understand the healthcare system, how to help patients navigate the healthcare system, some very basic things. And then they are essentially peer supports. You can pair them, put them into healthcare teams. And there's a lot of data that suggests that they actually help improve health outcomes across many topic areas. We also know there's not enough access to these community health workers. So that's why it's really, really important for us to expand our community health worker workforce. But we're also, particularly with Wayne State, we're partnering to train community members to be solid partners when it comes to research. We know that one of the reasons why disparities exist is not enough research happens, and not enough research happens with people who are from historically marginalized communities being involved. So that's also part of our partnership, particularly with Wayne State University, is training both faculty members and teams, but also community members with lived experience on how to partner so that we can make sure when research is happening, it's done with inclusion of people who are from these communities as well.
No, that's great. That's amazing. And also too, will the Alliance focus on additional health conditions in the future, you think?
Yes, for this initial launch of this initiative, we're focusing on heart health and mental health. We are looking at expanding potentially to other health topics. Our broader health equity strategy is also focused on women's health. So in the future, we will be looking at what other areas we would potentially expand on, but really focusing on building out these partnerships and learning from the communities and learning from our partners.
Thank you, Dr. Khaldun. Thank you so much again for your time. We really appreciate it. I'm sure our readers and our viewers out there definitely will appreciate it as well. Thank you so much.
Thank you.